Here at University Hospital Birmingham, we decided that investing in digital signage was really important for our communications and engagement strategy. It's very important to us that we have as much communication as possible with our patients, and digital signage enabled us to do this in a variety of ways that we couldn't do otherwise. Posters, leaflets, they all have their place, but really in today's modern society, digital communication is the way forward, and it was natural for us to take that step and introduce that into our patient relation programme. Our public screens, our digital signage system, they offer communications and information to our patient population, our relatives and staff, but mainly patients and their relatives who are coming into the hospital. Our 7,500 staff use the PC screensaver adaptation to be able to pick up information, key messages throughout the day. You'll sometimes see them both in the same areas at the same time, but the messages are very different. Both are useful in communicating effectively to both of these groups. For us, having such an interactive and instant form of messaging is absolutely key. Healthcare is an ever-changing field, and there's lots of things that go off throughout the day that we need to be able to communicate quickly and easily. Many of our staff don't have access to email regularly, so using PC screensavers or digital signs are a great way of being able to access those staff and give them the information they need. It also means that for patients, they're getting targeted information about their particular source of care in the right place at the right time. The NHS is asked all the time about return on investment, whether or not the technology or the solutions that we put in place are actually value for money. We tend not to think of it in terms of a financial return on investment, but actually more as a holistic, whole approach to what we are able to offer the patients and our staff that we wouldn't have done otherwise. Digital signage solves a multitude of problems for us, from being able to connect with patients and their families, as well as our staff, across numerous sites around the city. Return on investment for us is very much about what it offers both the patients but also the communications team. For many NHS trusts who have very small communications teams like ours, being able to produce and deliver and constantly update posters or leaflets around a hospital site is quite challenging, and actually digital signage and screensavers takes away some of those hassles. It would be quite improbable and would look ridiculous to have 50 or 60 posters on a wall trying to get across the messages that we need to. But with digital signage, we can offer the same volume of information in one simple, easy and clean solution. When you work in the NHS, infection control, cleanliness and the presentation of your hospital is very important to patient satisfaction and reassuring them that you're in a clean and safe environment. Digital signage looks neat, it provides the information and it ticks all the boxes. From a communications professional point of view, it's much easier to update one source of information than develop several posters, several leaflets and spend the time and resources in getting those out to your sites all across the city. So for us, digital signage solves all the problems. Content is always the most important factor in delivering messages, but it's really important that you have the right solution to enable you to do that. If you don't get your messages right, your audience won't engage, but if you don't have a solution that enables you to communicate with your audience in the first place, then your message falls on deaf ears. I think any NHS trust that is looking for a digital signage solution is very wise. Everybody these days is used to sitting in front of a television screen or interacting with content through a digital platform. It's very useful and it's very simple to use. It enables us to control the message from where it gets sent to, what time it gets sent to and how often it gets sent to. It gives you a huge amount of control with very little effort, and I think anybody who works in the NHS will find that this adds to their patient experience.